My name is Saqib Chaudhry. I'm the Chief Information Officer with Johns Hopkins Aramco Healthcare, or JHAH. My responsibilities include managing the information technology function for the organization and also responsible for the entire digitalization strategy for our organization. Very exciting time to be a CIO, especially in the healthcare industry, because the healthcare industry globally is going through a paradigm shift. And what I mean by that is we're moving away from acute care to preventative care. We're moving away from human-led surgeries and procedures to robotic-assisted surgeries and procedures. We're moving away from decision support to predictive and prescriptive analytics. We're moving away from inpatient care to telehealth and home care. And technology and digitalization is that bedrock that is enabling that paradigm shift within that industry. So very excited to be a CIO of not only of a healthcare organization, but a leading healthcare organization within the kingdom. One of the differentiating factors for Johns Hopkins Aramco Healthcare is it's in our DNA to be the leader in everything what we do. And especially when it comes to digitalization. We want to be the leader, not only within the kingdom, but we have global ambition to be that digital leader. And if I look at the fourth industrial revolution, where there is a very thin, almost a blurry line between the cyber world and the physical world, where everything is connected to everything else and everything is talking to everything else, it's almost impossible to make sense out of all that information without having support from artificial intelligence. And if artificial intelligence is that alpha technology, what fuels artificial intelligence, having access to a high quality consolidated data. Hence, it's extremely important for us to have a world-class enterprise data warehouse capability. And not only that, that capability should be augmented with the smart technologies such as artificial intelligence, machine learning, predictive capabilities, automation, etc. So one of the must-have tools for executives across the board is to have that right data available at the right time, so that we can make measurable decisions. We can understand what the data, what type of knowledge the data is producing. As the saying goes, you can have data without knowledge, but you cannot have knowledge without good data. So for us, just like for many other organizations, it is a must-have to have a comprehensive, leading enterprise data warehouse system. So we started looking for the best of breed enterprise data warehouse solution provider, and part of our requirements was to partner with somebody who can help us leap forward in terms of leap forward and also help us reduce the time it takes to produce outcomes, visualizations, and dashboards and data products. And that's where we identified Innovaccer as that leading platform that can not only help us build that centralized data enterprise data warehouse, but also we're able to utilize their out-of-the-box applications, be it related to population health, clinical costing, analytics, etc. And the most important aspect, especially in emerging economies and in this region, is the level of commitment. So you can have the best product in the world, but if the level of commitment from the team, all the way from senior management down to your analysts, if that commitment is not there, it becomes really difficult to get the most value out of that product. So one of the key differentiating factors for Innovaccer is that commitment, which we have seen today, and we look forward to seeing that moving forward as well. One of the key expectations out of this project is to initially help us address some of our pain points that we currently have, and support some of the strategic projects that we have. And a really good example is the population health And the advantage we have with Innovaccer is there is an out-of-box capability and application that can help us set up that capability in relatively much less time compared to some of the competition which is out there. And also some of the pain points that we have right now is fragmented data landscape, which hinders our ability to get the right data at the right time. And also the last challenge we have related to this is the quality. It becomes challenging to get the highest quality of data. So from a short-term perspective, we want our partner Innovaccer to help us address those challenges, support us on our strategic initiative, which is population health, and then grow this relationship as we move forward and have success stories together. Planning to be excited about, it's not only me, our entire executive team, list of key stakeholders across the organizations who have been patiently waiting for us to launch this initiative. As I said, it's in our DNA to be the leader in everything what we do. And with this capability, we will keep that rigor going. And we want to be the first in everything what we do. And as I mentioned earlier, one of the advantages of having Innovaccer as our partner is we can leap forward and become leader in how data analytics should be done in this part of the world. Also, in terms of how the mix of artificial intelligence, machine learning, the ability to predict, and then at some point prescribe, and then ultimately get to that cognitive capability of having cognitive analytics. That's what we look forward to. And also, some of the challenges that I mentioned earlier will help us free up. Well, some of the challenges that I mentioned earlier, this initiative will be able to address those challenges, and that will free up a lot of the repetitive and manual task, the time that goes into repetitive and manual task, and make us more data literate and help us get better quality information at the right time, at the right speed, so we're able to become a true data-driven decision-making organization.